to introduce Dami Asadju. Dami is a Band 7 therapy lead within the NHS and a physiotherapist by background, and has a strong focus on quality improvement and integrating sustainable, environmentally responsible practices into patient care and service delivery. And Dami will be presenting a SusQI project that was started as part of a Green Team competition, I think 2 or maybe closer to 3 years ago now, and on the exciting progress that's been made since then. So I hand over to you, Dami. Thank you.
Okay. All right. Thank you
So,
very
okay.
much. Hi, everyone. Good afternoon. My name is Dami. I'm here to present our entry for the Green Team project. I think about 2 or 3 years ago, titled "The Effects of Reducing Physiotherapy Referrals from Care Homes on Waiting Lists Through Health Promotion, Physical Activity, and Falls Prevention." Apologies, Sophie wouldn't be here today, so I'm just here to present on our behalf. Next slide, please. So when we looked back at our data back in 2023, entering 2024, we realized that about 20% of the referrals on our waiting list were from care homes. And many of the when the clinicians and the triage clinicians went through these referrals, we realized that a large percentage of them were for things that could have been sorted out without being referred to us. So they were just not aware of things that they could do on their own to resolve issues as such. And then looking at the long waiting list as well in the NHS, I know that's a common theme as well. So we looked at how we could do something different to help with our waiting list at that time, so that we would be able to attend to our patients that truly need us to attend to them. And luckily for us, the Green Team project came around that time, and we're like, yes, this might be a good opportunity to enter into this competition. And I mean, this also ties in with the NHS long-term plan, with the focus being on preventative care. We looked at a way to empower care homes and the staff in care homes to encourage physical activity, because another problem we identified then when we visited care homes was that many of the residents were just sitting idle in chairs with low or no level of activity. Next slide, please. So we had these 5 aims then to reduce referrals from these care homes by 35%, and 30% also the waiting times within 6 months, and to also reduce carbon emissions associated with travel. So we're a community team, and we used to go to patients' homes alongside care homes as well. So we're looking at reducing that by 30% within 6 months, and also any potential financial and time savings, and most importantly, to improve the quality of life of these care home residents. Next slide, please. Yeah, so just similar to the next slide, the measures we focused on were the total number of referrals received, the average waiting time in days, and face-to-face visits, and the mileage, and what that would cost, and the carbon savings and social impact on staff members being the care home staff. Next slide, please. So that leads to the changes we made. So we made just 3 changes back then. The first thing we did was we organized a webinar in June 2024, where we organized a webinar for all the social care workers and practitioners in Warwickshire County, and that was in conjunction with the Warwickshire County Council. We also recorded educative videos demonstrating how to adjust walking Zimmer frames, how to correctly get patients from sitting to standing, because we identified poor practices when we visited care homes. And then we also educated on how to adjust this equipment, what to look out for if the equipment were not in good working condition, how to escalate. We also shared information about referrals to our services and other services within a therapy ecosystem, and also how to signpost to the GP and other services and things to look out for. And we made sure that this webinar, alongside the the slides were shared and were uploaded on the Social Care Information and Learning Services portal, which is available to all social care practitioners in Warwickshire County. And that was made available to all the social care practitioners going forward. Another thing we did was we linked in with the our therapy triage clinicians, and we developed a new referral document, which was more like a screening tool to get care home staff to think twice and be able to justify the rationale for referring to our service, and just making those referrals really clear, because many of the referrals we got then were a bit vague, and it was just like they wanted us to just keep coming, and that was not sustainable. And I mean, the last thing we did was to educate everyone within our team, and to get every therapist going to care homes, because we had therapists assigned to different care homes, to keep reiterating this message to the care home staff, and encouraging all these changes that we had tried to embed, and to also signpost them to the skills portal as well. Next slide, please. Yes, so the results we recorded are shown on these slides. Although we're not able to reduce our referrals by, we're not able to meet the target of 35%, but we recorded 33 and 31% in across the two localities. So we've got two teams within our therapy umbrella, the Stratford team and the Warwick team. We also reduced the waiting time by 30%, 33% rather in Stratford, and by 70% in the Warwick area. Total face-to-face visit dropped across both sides, significantly better at Stratford, and that also impacted total mileage driven and the expenses claimed, including the carbon savings as well. Then we also looked at financial savings, that's appointments, so how much it costs per physiotherapy appointment, and we realized that these were the financial savings, including time as well. So we're able to channel that time into going to see other patients in their own homes. And lastly, the care home staff, they reported improved knowledge, ideas, and skills, and it made them feel a bit more confident, and they knew who to contact when they had any concerns. And I'll share more information about that in the next slide. So before the training, this was the level of understanding of the care home staff. Many of them were around they were around level 3, but at the end of that training, majority moved to they claimed they were at level 4 out of 5, and a sizable amount as well, level 5. Next slide, please. I'll try and breeze through now. And also we got feedback from them as well. They said they were content with the course and they were going to recommend it. And there was enough time for them to ask questions as well. It was well organized and easy to follow. So that was really positive from the care home staff as well. The first cohort. Next slide, please. And what we got from the care home staff as well was things that they had put into practice since the webinar, ranging from setting up hydration sites. They decided to audit their mobility equipment, looking out for worn-out referrals and things like that. They began to review activities to increase exercise sessions. I even got like a PDF document from one of the care homes showing all the activities that they had done in within a 3-month period, just to show that they had been compliant with it. I didn't ask them for it, but they were really proactive, and that was good to see. I'll just breeze past again. Next slide, please. Yeah, so back then our future learning and consideration was to look at the data for the same month. So it was October, November, December of 2024, 2023, 2024, and then we're going to look at 2025 as well. And like I said earlier, making every contact count. We just kept reiterating to every member of our staff to keep signposting this care home staff to the skills portal, and keep encouraging good practice, and to provide further learning opportunities for social care workers. One thing that's been ongoing since this SusQI project has been we started a falls class. We've been having falls classes for our patients within South Warwickshire as well, and that's still ongoing, and it's been positive since then. I think that leads me to the last slide, if you don't mind. Yeah, so we identified the problem being having so many referrals on our waiting list that were not appropriate. In turn, we tried to to make this a benefit for the residents of this care home by encouraging physical activity and healthy practices, and also we also established good professional networks, and we're able to get care homes to be more proactive in terms of preventative care, and it was a very good experience for us. And we all know that with the growing number of elderly residents in residential care homes, it was not just for us to look at the environmental sustainability, but we also looked at how we could save money, how we could improve quality of life, and also the clinical sustainability. And that brings me to the end. Thank you very much for listening. I'm here for any questions.
Thanks so much, Dami. Obviously, you know this, but others on the call don't know that I had the privilege of working with you and Sophie through your green team competition a few years ago.
Yes,
And
thank you very much for that.
you, we discussed at the time it was very, very ambitious to have such a kind of large scale project in a competition which only has a 10-week time frame. So to
Yeah,
hear about how you've continued to build those collaborations and across a range of different settings as well, and see all the benefits realized now, and also the enthusiasm and great feedback from the care homes is really exciting, because that's
yep.
obviously not something we could collect within those 10 weeks. So yeah, huge congratulations for continuing, and it's very exciting.
Thank you.